Hello, everyone. By the way, my name is Desiree Espancha, and my crisis management plan is all about the COVID-19 pandemic. So, the risk analysis of this crisis is that the COVID-19 or coronavirus disease is a recently discovered virus, and it is a global crisis that affects thousands of people in different ways, including loss of jobs, loss of business, loss of income, and most especially loss of lives. In the Philippines, from 3rd of January 2020 to 10 a.m. CET 26 March 2021, there have been 693,048 confirmed cases of COVID-19 with 13,095 deaths reported to the World Health Organization. Due to the increasing number of COVID-19 cases, um, a crisis management plan is being created in order to minimize the massive rate of reported cases, particularly here in the locality of Davao City, in which this area get the highest confirmed cases cities in the Philippines. So this plan of action is certainly made for the security and safety of everyone, and all of us must open our mind to cooperate with the local government agencies and frontliners upon facing this crisis since this is not easy to be solved in one day, week, or even a month, but it takes time to overcome. And that particular reason, people must be fully aware of every action they will do and know what are the things they must supposed to do if their lives are at risk. For the activation protocol, this is the levels of urgency as criterion on circumstances and crime responses. This will triggers of the crisis in the community. For the case severity, there is a critical, severe, and moderate and mild case. And for the critical case severity, the crisis response to the hospitalization for isolation and inpatient treatment, the suspect of COVID-19 cases according to the diagnostic strategy. Next is severe. Patients should be instructed to self-isolate and call for hotline for emergency referral as soon as possible. Next is moderate. The suspected COVID-19 cases according to diagnostic strategy, isolation and cohorting in health facilities and community facilities, self-isolation at home according to the World Health Organization guidelines. Next is mild. Patients should be instructed to self-isolate and contact COVID-19 information line for advice on testing and referral. Furthermore, the circumstances, there would be a level 1 up to 4. For level 1, active this is the active exposure and spread of the virus, wherein the crisis response must be check yourself and your family daily for COVID-19 symptoms and contact your doctor if symptoms start such as the following: fever, chills, cough, fatigue, sore throat, and such. For level 2, the increased exposure and spread of virus. Follow all the guidelines in level 1. Use caution when out and about. Avoid contact with anyone considered high risk. Be social with people inside your household and small bubble. Next is limit unnecessary visits to hospitals, nursing homes, and residential care facilities. For level 3, very high exposure and spread. Follow all the guidelines in level 1 and 2, plus don't leave home without wearing face mask. Limit being out and as much as possible, sanitize your hands with alcohol. Decrease in-person interaction with others. Travel only when necessary. Avoid social gatherings of any size. For level 4, severe exposure and spread of virus. Same guidelines as 1, 2, and 3. Plus, go out only for essential supplies, services, or work. And lastly, stay at home. For the chain of command, these are the lines of authority for crisis management. So crisis manager are responsible for planning and implementing the responses to a major threat, identify risk, prepare contingency and recovery plans, and manage resources during the crisis. Next is security manager. They will monitor the security operations and implement security policies, regulation, norms, and ensures the safety of organizations company. These are the PNP and the military. Next is medical advisor or the doctors, responsible on checking and assessing human health impacts of the event. PR advisor, they will maintain public figures and responsible entertaining medias, internal staffs, and other associates in business. Next is legal advisor, plays an important role in crisis response, provides legal advice, supervises internal investigations, and work with the internal and external organization's communication team. For HR advisor, they will improve the relationship between the management and the employees, also ensure the preparedness of staff during crisis and emergency. For IT advisor, uses social media in providing and giving visions on the city's crisis crisis. For communication advisor, supervises and coordinates necessary support roles in managing and risk exposure and stakeholders' interest to achieve change. For command center plan, this is the base of operations for the crisis response. First is screening, an area in which an individual is evaluated and screened using the case definition. If the person becomes a suspected case referred to COVID-19 protocol. Next is isolation. If the case is met, the patient should immediately be given a mask and directed to a separate area, and at least 1 meter distance should be kept between suspected patients and other patients. For during the community transmission, there will be need for multiple COVID-19 treatment areas. A hub and a spoke model of referral is recommended, such as the hospital with triage and COVID-19 dedicated ward, and primary health center with triage and temporary isolation room. And lastly, ambulance. This will be used as a medically equipped vehicle which transports patients to treatment facilities. For the response action plans, this is the detailed plans for the action the management will gonna take. So there is a triage in this picture, triage facility wherein this is the acuity-based triage. Triage is the standard method of sorting patients in the medical setting. This is used as the basis for identifying patients who require medical interventions, patients who can safely wait, or patients who may need to be transported to a specific facility based upon their condition and may need to be transported to the specific facility based upon their condition. And standard validated tools should be used to assess for severity of patients and designation to the appropriate facility. Excuse me. For healthcare system, such as the integrated interagency triage tool. For the if the patient has a mildly case or symptoms concerns about having COVID-19, the patient calls COVID-19 hotline, call information, and patient is instructed to go for testing and designated site and be evaluated at community center or to stay at home in self-isolation to determine by the testing strategy and available facility resources. And if the patient will have a severe symptoms that will concern about having COVID-19, patient the patient will call pre-hospital care service and a basic COVID-19 ambulance is sent for the patient, and then the patient will be transported to a facility screened as suspected COVID-19 patient and triage to appropriate level of emergency care based on acuity of disease presentation. For the internal communication, this is the system for crisis team communication and information sharing with the employees. So the operation team will be the medical team and the area monitoring team, wherein their responsibility is to provide immediate care in case of emergency, provide reports regarding COVID-19 cases, monitors the condition of patients, facilitate quarantine areas. And they will gonna use a two-way radio or an Android phone to connect with other team. So the area monitoring team is in charge of monitoring the area with high rate COVID-19 cases and checkpoints. And also, they provide immediate report all throughout the teams to secure the situation around the area. For the external communication plan, this is a plan for communicating media and the public. So for the patients who have symptoms, they should get a medical care right away for medical emergency. They will gonna call the 911 and notify the dispatcher that they have a COVID-19, they may have a COVID-19 symptoms. And emergency warning signs of COVID-19 can be include trouble breathing, pain, pressure in the chest that won't go away, new confusion, inability to arouse or wake, or pale gray or blue colored skin, lips or nail beds depending on skin tone. For the resources, this will be the information, equipment, supplies outside advisors to have available. So these resources will be used by the management team and also for the public and for the safety of everyone. So they will use a personal protective equipment such as um, goggles, face shield, medical cap, surgical mask, N95 mask, shoes cover, alcohol gel, alcohol spray, disposable gloves, and leg cover. For the training, these are the plans for practicing the crisis response. So everyone um, must perform this training in order to help everyone to become safe in different places. First, stay at least 1 meter away from people and even further when indoors. Next is wear a face mask around others. Next is avoid places that are crowded, confined, or involve close contact with others, especially indoors. Another one is wash your hands regularly or use an alcohol-based hand sanitizer. Next is avoid touching your face, especially your eyes, nose, and mouth. Then cough or sneeze into a tissue or your elbow and then throw the tissue away and wash your hands after. Next is clean and disinfect surfaces regularly. And lastly, stay at home and call your health worker if you are unwell. And lastly, for the review, this is the procedures for updating the plan and analyzing crisis response. So the crisis management team will assess the situation, determine all facts, and begin the delegation of work. The following review process should be able to help to develop an appropriate crisis response. First, set up screening and triage protocols to all points of access to all system including primary health centers, clinics, hospital, emergency units, and ad hoc community settings. Set up COVID-19 telephone hotline and referral system to refer patients to the appropriate destination for clinical assessment and or testing as per local protocol. Next is set up COVID-19 designated wards in health facilities, conduct active case finding, contact tracing and monitoring, quarantine of contacts, and isolation. Fifth, care for all suspected and confirmed COVID-19 patients in isolation according to the disease severity and acute care needs for treatment at the COVID-19 designated treatment area. Six, Continue rapid and thorough contact tracing and quarantine of contacts. Surge the health system with new structures established for care delivery, including rapid extension of designated hospitals to care for COVID-19 patients. 8. Referrals adopt a hub and spoke model with a central COVID referrals facility and all other health facilities in each geographical area, referring patients to the nearest center. 9. Manage all mild and low moderate risk patients with confirmed disease in designated community health facilities with access to rapid health advice or at home according to World Health Organization guidance and national or subnational capacity. 10. Engage everyone in hand washing, respiratory hygiene, and physical distancing. 11. Access local 24/7 COVID-19 telephone hotline or designated number that patients can call for information and direction about when and where they should seek care. 12. Access local authorities' social media accounts for specific information on COVID-19. 13. Understand community coordinated network with local government authority, public health unit, district medical officer, pre-hospital care services, including community health workers, community health aid responders, ambulance services, and hospitals. For 14, develop a supply procurement and distribution plan for personal protective equipment and biomedical equipment, including contingency plan for shortage. 15, ensure staff dedicated to communicating with patients, visitors, and media as required. 16, strengthen infection prevention and control IPC measures to mitigate healthcare worker and nosocomial infection. This includes identification of IPC focal points, COVID-19 IPC trainings, ensuring availability of key documents at all levels of care, SOPs, communications, materials, visual alerts for screening, visitors policy, and IPC supplies. 17. Strengthen measures for protection of occupational health, safety and security of health workers, prevention of violence, addressing fatigue and access to health care and social support. 18. Communicate the details of COVID-19 designated facilities to all command and dispatch centers for appropriate destination triage. 19. Dedicate transfer vehicles and ambulances for all suspected confirmed COVID-19. 20. Ensure that IPC measures are always respected during the patient retrieval and transport that vehicles are disinfected properly. 21. Establish COVID-19 areas within health facilities or designated separate COVID-19 hospitals. 22. COVID-19 treatment areas should be designed to deliver life-saving oxygen therapy. Most patients hospitalized with severe disease will need oxygen and a smaller proportion will require ventilation. 24. Plan for repurposing of wards for severely or critically ill patients. 25. Plan for community facilities for isolation of mild or moderate patients or for isolation at home. 26. Re-evaluate COVID-19 discharge criteria and position during recovery period. And lastly, establish simplified purpose design, governance, and coordination mechanisms to complete response protocols. The impact of repurposing health system capacities for COVID-19 care should be evaluated on a regular basis. So take note that the structure review process may change according to the circumstances or any changes of crisis management plan. So the crisis management team will conduct yearly evaluations to make necessary reviews and appropriate adjustment. Again, so this COVID-19 pandemic crisis management plan is designed in order to lessen or mitigate um, the danger that everyone will gonna face, and a reminder to every one of us, be safe and wear mask, always wear mask, and then um, social distancing is a must. Use sanitize alcohol, and then always stay at home. And that would be all. Thank you.